We have a lot of questions for, whose job is to make beautiful women even more beautiful. Let's welcome into the mini mansion Dr. Raffi Hovsepian.
Thanks.
Hello.
Oh, looking sharp, man.
You look amazing.
All right.
Hey,
We are
thank
quite
you. Have
well.
a seat.
Thank you for joining us. Yeah, you know, some people's bodies come easy to them. I prefer to hit the gym and eat well, but not everyone has amazing genes, and that's where you come in, doctor.
Nice suit, by the way.
Thank you.
What suit is that? What brand
It's
is
Armani.
Armani.
Yeah.
Look at this guy. Showing me up. That's,
And you're based in Beverly Hills.
Correct.
Of course, you have to look great if you're surrounded
Yeah.
by wealthy people. You got to look the part.
yeah, you gotta look well groomed. I mean, if I was, going in for some plastic surgery,
Consultation.
right? And somebody looked like they just, crawled out from under a rock or came out of a cave. Looked like they just took a break from some travel pit truck stop. I would be a little hesitant.
I
Now,
agree.
doctor,
look
looking at Dan, just basically, is there anything you
Oh,
see off
God.
the bat that he would need correctively?
Oh, Jesus.
He's a perfect specimen, as we would call him.
Great answer. Look
I was
at
not
that.
expecting that. I was like, oh, here we
Perfect
go.
male specimen.
Thanks. What about, now I have gut weight.
Yes.
That's the hardest. I have good muscle everywhere else, but right here, what would you recommend? Just for is it the lipo? What do people do now? Or there's a new procedure I heard about.
Well, liposuction is usually a standard procedure that we use.
Okay.
And nowadays we're advancing the technology of liposuction. We're using lasers that will melt the fat, tighten the skin to kind of expect you to not only lose kind of those inches, but get that skin contraction, whereas traditionally we never got that skin contraction.
Right.
We just
okay.
brought
There.
in the inches and you could get some loose skin.
Is there
Yeah.
is there a procedure to remove years and years of cheap diner gravy from the inside of my veins?
That's changing your lifestyle.
Okay.
Got a clog. Is that what's going
I
on?
might. They're probably getting tight in there. My girl does want a possible a boob job. She's worried about how being overly hard is her fear.
Yeah, too firm.
Too firm. Do you have is there new techniques?
Yeah,
or
the current trend nowadays is more of the cohesive gel implants versus the traditional saline or the old silicone implants, which give it more of a natural look, more of a teardrop shape. And they
And a
feel
nice squish, right?
Exactly.
I didn't know about
they
those.
feel a lot softer. They conform better to the body. So saline implants are kind of your older generation appearing breasts, which are firm, very round.
Right.
Nowadays, women want a softer, more subtle look. And when we were in the 80s, 90s, it was all about large size of
Volume,
implants.
yeah.
Volume. It wasn't about necessarily the aesthetics. It was just the bigger the implant, that was the concept.
Right.
Nowadays, things have changed.
Yes.
The trend is smaller, more petite, more of a European, South American appearance. Whereas the buttock has now taken over in this nation.
Yeah,
that's the new trend,
the
right?
The trend is booty everywhere. Now, as you know, the Oscars were last night. In the celebrity world, what percentage of female actresses or celebrities do you think, in your professional opinion, not saying that you've worked on them, have had plastic surgery?
Well, the celebrities start young, and that's the difference. The general public usually waits until things have gotten out of hand before they come in.
They need help.
And so it's noticeable, whereas the celebrities start very, very young. And they start the simplest way is skincare, Botox, preventative. And they prevent things to kind of getting more on the rough end, I would say.
Yeah.
Right.
So they all start young. And you could consider maybe skincare as possible procedure, but truly it's not. And when it comes to plastic surgery, we're doing things subtle because you have to realize that their face, their body is the moneymaker.
Absolutely.
And if you drastically change it, then you could ruin their entire career.
Right.
So you have to keep it within their aesthetic lines without the public knowing. And the best thing to do is, right when things are just getting out of hand, to come in, do a touch-up versus a drastic change.
Absolutely.
I like what you're saying about subtle, like little changes, because you gotta. I see people around, our town, obviously LA, who have gone the
way too far.
Not so subtle. It's like they walked into a place and they're like, I want to look like a mannequin. I want to look like a scary mannequin.
Right.
Do you ever have patients where you have to tell them, enough is enough?
Yeah, I mean, I agree with you. Our practice is a little different because You know, we're here to protect our patients. Our clientele is diverse. We have our celebs, we have our dignitaries, we have diplomats, but we also have our regular housewife, school teacher, fireman, you know. So
potential morning show host.
Yes, exactly.
Sounds like it could be a candidate, Dan.
Okay. I'll get some work done.
But, you know, we want to educate them on the procedure that they're getting.
Yeah.
Right.
And to make sure they're an appropriate candidate. So in my practice, we sometimes, I don't want to use the word turn down, but say no to about anywhere from 25 to 30%
Oh,
monthly.
wow.
And it's not a bad thing necessarily. It's either I don't think they're prepared for the procedure, they look great, they just need somebody telling them they look great.
Yeah.
Or we could buy some time, and just because some, like a friend or somebody, your colleague got the procedure, doesn't mean you should get the procedure.
How much would it cost just to have a couple inches taken off of your dick?
For you?
Oh,
we'll do it for free tomorrow.
I just wanted to say that. I don't have that problem.
now
I just wanted to
not
actually
a real
say that.
procedure,
It's not a real
right?
thing.
No one has ever asked for a dick
I've never heard
reduction.
of a reduction.
I wish I had that problem. No.
No.
That is now. There's a difference between like music celebrities
And the aesthetic versus like film celebrities, or
Yeah, you know, we have both genres, I would say, and you have your music celebs, you have your movie celebs, and the regimen is a little different. Usually the movie industry has kind of a timeline where we could work with, and we start early. Let's just say if they're doing a movie within a year, we're starting already today.
Oh, wow.
Basically.
Okay.
Yeah.
because they need to heal.
Exactly. And also subtly transition into the public.
Wow.
Whereas our music industry,
smart.
they could get a gig tomorrow.
Right.
We're very kind of stressed for their time frame of recovery, getting the procedure done, making an album, going on tour, etc. So it's a little bit more intense on this spectrum.
How did you get into celebrities? Like how did it start? I mean, you know, you come out of medical school. You know, you get how do you get known in the celebrity world? Other than just, I mean, you're very, very good.
You know, it eventually comes down to quality of work.
Absolutely.
Okay.
And it doesn't matter if they're celebs or, like I said, a regular housewife.
Right.
It's doing the quality of work and taking care of your patients. And, you know, we keep things quiet in the sense that, you know, we protect all of our patients.
Wow. Okay. Wow. That's fantastic. And people, if they want to get work done, you know, from you, from your team, just rhmd.com. Is that where?
That's our website. You could get on rhmd.com and go from there. All our social media is listed on there, and our phone contact.
And you're Dr. Hovsepian on Twitter, right?
Twitter,
and everything. Do you have Instagram?
Yes.
To showcase
nice.
your work?
I'm going to follow you. I love looking before and after pictures.
I think we have some of that stuff here today.
And the doctor will also travel all over the world. Now, what is this here? Is this liposuction, or is what is
this is a technique that we pioneered in my office called shrink wrap liposuction, where we're using advanced technologies.
She has a six-pack on the right.
Yeah, and that's a mother. That's 4 months after her pregnancy.
What?
So that for before photos, 4 months after her pregnancy, and we opted to go under the liposuction.
Okay, Dan, this is what I'm talking about.
Yeah.
So tell us how you've created this shape here, doctor.
So, you know, selection of a patient is the most important thing. And you kind of brought up, do we say no to patients? Well, yeah we do. Yeah. And the reason being is we want the best result for them.
Yes.
And that was a perfect example of when you take care of the problem area, such as in your situation, Dan, the waistline, it motivates you to live a healthier lifestyle and bulk up elsewhere and maintain the result. That's what we want you to do. What we don't want is to see this revolving door of plastic surgery where you're coming in and constantly getting the procedure done.
Yeah, you got to do your upkeep.
Exactly.
So I got to take care of it. I got to like ease off the biscuits. If I get the work done initially, or I'm going to be right back where I was.
Now, are you noticing with the music industries that they're doing more like they want bigger butts and stuff, and the actresses more want facial work? What's kind of the trends there?
You know, it depends. Well, the actors and actresses depends on the movie role. First of all, if they're showing their body, it's obviously going to be body work. If it's facial work, then it's going to be subtle touching up. As far as the music industry, it's more body work. And because most of the time, to be honest, after the age of 40, 50, they're kind of dying out of the career, right? Versus your big movie celebrity, they're still in it.
Right.
Wow.
So, you know, it's more body work, I would say, for the music genre.
For sure.
Well, thank you so much for coming in. I may come seek you out because I don't know if I'm going to be able to change my diet. I feel like a salad is a punishment.
But however, your girl does want boobies, and he's the master.
Yeah, he's the best. He really is. So check him out. Again, it's rhmd.com. That's Dr. Hovsepian, and that's you can find him all over social media. And congratulations on having the premier practice in Beverly Hills, which is really the world. When
absolutely.
You're talking about
you're
cosmetic
the best
surgery.
in Beverly Hills. You're the best everywhere.
Yeah, thank you for coming in, man. That was amazing.
It's the Playboy Morning Show.